Okay, go.
Hi, good morning, guys. It's Dr. Denney over at Four Paws at Fulshear, and today Maddie and I are going to be talking a little more about feline nutrition or cat nutrition and some questions that you might have and some things that you might not have known.
Dr. Denney, how does nutrition impact the health and well-being of my cat?
So the same way it would affect you, like you as a human. So food is energy. Food are the building blocks of life. We need food to be able to fuel our bodies, to be able to grow, to be able to survive. Like nutrition is a huge part of that. So in general, if the cat isn't eating, that's a problem. Food is important.
What are the nutritional requirements for a cat?
So it's a really good question. So cats are not small dogs. So cats are carnivores, which means that before they were domesticated, they got primarily all their water and nutrients from raw meat when they were hunting. So cats actually have not been domesticated for as long as dogs. Dogs are omnivores, which means they can have both vegetables, fruits, and meats. Cats are obligate carnivores, meaning that they need kind of a higher protein diet. So we're going to kind of get into that a little bit more. So higher protein requirements is what your feline is going to need. They do require a lot more protein than dogs, which is very important. It helps them maintain muscle mass, maintain kind of a healthy physique. We also can see issues where, overfeeding cats, which we'll talk about a little bit more about later. Cats can be really prone to weight gain, so we do have to watch that. But they can get all of their amino acids, their minerals, all of their things cats can get from their diets. I will say that we do like our felines to be exposed to wet food from an early age, just because the studies have shown that wet food's actually better for your cat. It is a little bit more of an inconvenience, just because if they don't eat it all, then it dries, then you have to watch it, and it's a whole thing. But we do want to make sure that all cats are at least exposed to wet food when they're kittens. So if they are ever sick or if they have to transition to a wet food diet later in life, that they have had that experience, because cats are very, very, very picky eaters.
When it comes to cat food, what and how much should I be feeding them?
So it depends on your cat, depends on your weight, depends on if they're spayed or neutered. So most of the bags that you buy will have on the side, will have recommended feeding, and we can follow those guidelines. Now what does need to be taken into context is if your cat is spayed or neutered. If that happens, then their metabolism is going to be a little bit lower than if they were intact. And the bags of food are made for cats and dogs that are intact, so their energy requirements are going to be a bit lower. So when you are feeding your cats, I always want to say you want to shoot for 10 and 20% less than what is recommended, just to account for those calories.
Will my cat's nutritional requirements change throughout their life as a kitten, adult, and senior cat?
So 100% yes. So just like human babies require, multiple feedings a day, a higher calorie content, because why they're growing. Bones, muscle, everything takes a lot more energy when we're younger and we're using those calories. So as kittens, they're gonna have a higher calcium, higher protein, just higher calories in general, and they have to be really easy calories. And it's especially important when we have young babies. Bring this to me. Oh my goodness, this is obviously not a cat. But this little baby, this needs to be on puppy food, right? Because we're growing and we're a little Pomeranian. Okay, we're gonna get back to cats now. He's so cute. I can't handle that. So adult cats are gonna be fed adult cat food. So that's once they reach at least a year. And then starting around the age of 10 is usually when I start to recommend, hey, if we are having weight problems, maybe switch to a senior cat food, or sometimes you can even wait until 12 or 13. It's also based on the specific cat, their lab work that they should do once a year, and all over their general health.
What are some signs and symptoms of poor cat nutrition in your pet?
So poor cat nutrition in your cat can show a variety of symptoms. The most common is going to be ill thrift, meaning their coat's going to be very dry and brittle. They may have hair loss, thinning. If they're losing weight, vomiting or diarrhea, all of these things can be food related. I would say one of the number one causes for younger cats to have kind of an ill thrift and just not a nice hair coat is intestinal parasites. And the reason why they have this not good hair coat is because those intestinal parasites are actually stealing the nutrients from the body and preventing that cat from absorbing those nutrients and making sure that the coat is nice and healthy.
What are some common food allergies in cats, and how can I tell if my cat is suffering from them?
So food allergies in cats, generally we're going to see symptoms like inflammatory bowel disease in people. So either vomiting or diarrhea, those are going to be kind of your top two symptoms. So occasionally we can see chronic ear infections. Now it is a bit of a misnomer that cats can become allergic to grains. It's actually the main meat protein in their food. So the most common food allergies that we can see are beef, chicken, and pork. Those are our top three. If we are trying to transition foods and we say we go from a beef diet and we think our cat's getting bored, so we switch to a salmon, always make sure you do it very slowly over the course of a week. You switch too fast and you're gonna end up with vomiting and diarrhea, and you'll end up coming to the vet's office, which we all wanna stay out of the vet's office because we don't wanna spend money. So making sure to do a very slow transition is important, but food allergies in general, you're going to see vomiting and diarrhea, or chronic ear infections are another big symptom. Okay, and it looks like that's going to conclude our talk for today.